A good physician treats the disease, but a great physician treats the disease, treats the patient who has the disease. A very good evening to all my doctors and a very warm welcome to this podcast, Treat with Medicine, Care with Words. My name is Priyanka and I will be the moderator for this session. Healthcare services is one of the most hardest and the most emotionally draining profession. Doctors are only continuously trying to serve patients, and it drains out a lot of their emotional strength. So it is very important for them to have the well-being mentally as well as physically. We totally understand and acknowledge the fact that intellectual intellect is really important in terms of their professional upskilling. But the fact cannot be ignored that emotional intelligence and behavioral skills play a really important role, or I would say one of the very important keys to the professional success. So, to discuss more on this, we have today with us two very subject matter experts, Mr. Anil Nagpal and Dr. Neeta Mahatre. Dr. Neeta Mahatre is the founder of Reach Out Passionate Psychiatrist, and she is a motivational speaker. She has also delivered talks in TEDx. She does customized trainings for healthcare professionals. That is her key domain. On the other hand, Mr. Anil Nagpal is a result oriented professional and is been into training since the last 34 years. Mr. Nagpal is also the owner and chairman of Agile HR Private Solutions. A very warm welcome to both my speakers today. So, before diving into this very interesting topic on is behavioral skills really very important for healthcare professionals, I would like to give you some very interesting facts. Did you even know that even 80% of the errors, sentinel events, and errors that happen in hospitals are due to lack of communication? And the risk literature again further supports these findings, stating that 70% happen due to miscommunication with patients. Now, with significance to this, I would like to ask both of you this very important question. What do you think are the common communication challenges that doctors face while interacting with their patients? Anil sir, I would want you to address to this question first. Please take it ahead.
Thank you so very much, Priyanka, for giving us this opportunity. So, first and foremost, I would like to say that hospital is a very unique place. Now, why I'm calling hospital a unique place? See, hospital is a place where there are some patients who take their first breath, whereas there are some who take the last. There are some patients or some people who start their life in a hospital. There are some people who end. In fact, there are many patients who get to know in a hospital that they are now free from fatal disease, and there are some who get to know that they have one. This is a place where many people start their lives, many people end their life. So, and another important thing is that many people exit from hospital with smile on their face, and many exit from the hospital with tears in their eyes. So, in such a scenario, it becomes extremely important that we give utmost care to the patient. See, when we are treating our patients, there are most of the doctors who give very good medicines, very good suggestions on other therapies, whatever is needed. But when it comes to communication, this is one area where not only in India, but in other countries also, it has been noticed that many hospital professionals, whether it is doctors or paramedics, they fail to do so effectively. In fact, when we talk about sentinel events, there's a very interesting data, what you just briefly mentioned. So, doctors, I'm sure, are very well aware that sentinel events are those unanticipated events in a patient's life history, which may cause physiological impact, psychological impact, and may even lead to death of the patient. And the most important part is that this is not at all related to usual course of disease. And it is really very surprising to note that one of the most common cause of sentinel events globally is improper communication of doctors or paramedics with the patients or their relatives. So communication definitely plays a significant role when we talk about treating a patient.
Right, rightly said, sir. Communication plays a really important role. I think with the right communication, not only with patients, but also with the medical staff, be it the nurse or be it anybody who's working with the doctor, we can minimize and reduce sentinel events to a certain extent. Neeta, ma'am, I would also want you to throw some light on this. What do you think are the common challenges that occur due to communication, especially?
So, first of all, a very warm evening, and thank you, Priyanka, for this opportunity. I think the main component, a doctor patient rapport, the main key is effective communication. I would not term it as good communication or bad communication. I would like to term it as effective communication. And while talking about effective communication, especially in the healthcare sector, is also one more area where we see medical legal cases. And while the communication is inappropriate, while the usage of words may be inappropriate, not as per the understanding of the patient or of the caregivers, and even at times from the paramedics, whether it is dosages, whether it is handover, takeover, if the communication is not done appropriately, the counseling, the accuracy of diagnosis, everything changes. And while this changes, the whole scenario, while we talk about, time and again, we have been always been talking about malpractice action, which occurs in the organizations, is only because of communication failure. So I think it is very important that how you communicate, why you communicate, and how do you also focus on communication. And healthcare being a service industry, we do not have a product, we only have a service there. And when the service is being really been given to our clients, to our patients, to our caregivers, it's important that we need to have effective, clear, concise communication with lot of smile. Of course, while you're handling sentinel, there are emotions, but a smile has to be there on your face with communication. It adds on to a charm. Hope I answered this.
Yes, definitely, ma'am. So, what I picked up from what both of you said is communication plays a really important role when it comes to healthcare, especially. It can minimize the occurrence of sentinel events. We can also avoid medical legal challenges. Now, linking towards this, I would also want to ask you something else. Now, how can developing behavioral skills, soft skills, can reduce the errors and can increase the quality of patient care in the medical practice. If I could want, Neeta ma'am to please take answer this question first.
So for me, what I understand is every human loves to be heard and every human loves to talk.
Right.
And of course, we understand that time is the key and time is very, very crucial. Managing the time effectively, if we also gather proper, appropriate informations from the patient for accurate diagnosis, for appropriate counseling, establishing a good patient and a doctor relationship, there definitely communication plays a major role. Apart from communication, I also feel there should be adaptability to new technologies, adaptability to language, because healthcare has always been diverse. However, we talk about diversity, equity, inclusion now. In fact, healthcare and education has always been diverse. We meet people from different areas, geographical locations. So, how about speaking their language? How about accommodating? How about taking that adaptability? How about also giving that 5 minutes extra if someone requires that emotional concern? So I think communication and adaptability with this combination would be amazing, and it really works wonders.
So, very nicely mentioned by Dr. Neeta on communication and adaptability. So, Priyanka, here I would like to talk about two more very important aspects. One is regulation. So, when I say regulation, I mean self regulation. So, what is this self regulation or regulation all about? See, what happens that many times, whenever we are treating our patients, there is a possibility of some situations where there is a disruptive impulse. Right. When I say disruptive impulse, so there could be a possibility of some anger outburst, possibility of those situations.
Mm.
Now, how compatible are we, or how comfortable are we in controlling this situation? How effective are we in controlling this situation? We need to control our emotions, self-regulate ourselves, and then act accordingly. See, here, what happens that in any disruptive impulses, people generally react.
Right.
Really, we have to respond. We don't have to react. Here, I would like to give you one very interesting example. Some time ago, what happened that a boy and girl were about to get married. So just a day prior to the marriage, this boy gets a message from the girl that, sorry, I cannot marry you because I'm getting married somewhere else. So the moment he saw this message, he was shocked. He immediately went to his parents. His parents saw this message. They were also in a shock. They immediately called the banquet hall. The wedding is cancelled. They called all their relatives. Please do not take flight tomorrow. They also canceled their flight because wedding is cancelled. After about an hour, this boy gets another message. Sorry, send this message to you by mistake.
Oh my God, that is a major miscommunication.
Yeah. Though in this situation, the bigger challenge, there were two challenges. One was that we will have to, these parents will have to inform everyone again that please come, wedding is not cancelled. They'll have to do the booking again. The second bigger challenge was that whom that message
Who
was
was
meant
she
for.
supposed to send it to? True.
Now, here, see, this was the reaction. Had they just given a thought over it, spoken to the girl or to her parents, probably the situation would have been different, right?
True.
So this is just one example, but then in healthcare field also there are many situations where we react and we do not respond. So if we give some time to ourselves, understand the situation, and then respond. So this regulation is something which will turn out to be very useful exercise. In addition to regulation, another thing which I would like to mention is empathy. Now, so many people now, when we talk about empathy, they have a very simple definition about it with them, stepping into the other person's shoes. So this definition looks very simple, but when we talk about this concept, it is really very, very difficult concept, very huge concept.
Right.
So empathy is something where we need to not only understand the other person's situation, we need to modify our body language, we need to modify our words, we need to modify our feelings, we need to modify the way we act, and then reflect that, yes, we are understanding your pain and we have to convey it across to them, and then move ahead. So this is something which is very, very important in patient care. So communication, as Dr. Neeta has mentioned, in addition to communication, adaptability, then regulation and empathy. These are the four pillars.
Okay, so you know what? Picking up these 4 points from you, I have created an instant acronym here. It's called the CARE acronym for healthcare: communication, adaptability, regulation, and empathy. I think
Oh, yes,
if
wonderful.
any healthcare professional can master these four, they would step, a ladder up in their career, and they would be recognized as somebody who's contributing very rigorously to the healthcare systems. I hope both of you agree with me on this.
Yes, absolutely. Wonderful. No doubt.
Great.
Completely, completely.
Right. So now when we are talking about, communication, empathy, and, treating our patients the right way, do you really think all of this matters in the patient satisfaction or treatment outcomes for that matter of fact? What do you think about it, Anil sir?
Priyanka, this communication definitely holds a lot of value when we are
Hmm.
treating a patient. In fact, one of the expert has nicely mentioned that whenever we are treating a patient, we definitely prescribe a lot of medicines to the patient or some other investigations or exercise. But this person says that communication is an important part of prescription and needs a greater thought process than the medicines prescribed to the patient.
Right.
In fact, there are many patients where communication is the only treatment to be given.
Hmm.
However, invariably, this is prescribed in subtherapeutic doses. This is the biggest challenge we are facing today. Now, there'll be many medical practitioners who will turn around and say that, see, in Western world, these people give a lot of time to the patient. If you will see in a day, they see hardly 10 patients. Now, many people will say that in India, the situation is totally different. And even I have seen that in any hospital, government hospital or any other popular hospital, in a day or in OPD of 3 to 4 hours, sometimes doctors see 200 patients. Now, this is a very difficult situation. See, but then there is an advantage also to it. Now, I'm not saying that in India we are absolutely wrong and in Western world they are absolutely correct. Give you one very interesting example. About a year ago, my son relocated to US for his higher education, and within few days he injured himself badly. His one of the finger got injured badly, and he needed some immediate attention. So he was a little scared initially, but then when we insisted, he tried to take the appointment of orthosurgeon. And can you believe that it took him 8 days to see a orthopedic surgeon after that injury?
Oh, just to see a doctor.
Yes, and not
Okay.
only that, he got his x-ray after 20 days.
Oh God. Okay, that's a long time.
That's pretty long time.
Yeah.
Imagine what would happen in such situations.
I
Whereas in India, we are fortunate enough that we are living in this country where all these services are available at the snap of the finger.
exactly. I agree.
So that is one of the very big advantage. And yes, one thing which I would like to say here is that, see, definitely we are sometimes overburdened with large number of patients, but whichever patient is critical, where there is an extremely important requirement for communication, please do spare time and communicate effectively with the patient or their relatives, not only for doctors, but for paramedics also.
Right, sir. And the incident you've mentioned is really shocking, and I think hats off to all our Indian doctors, and a big, cheer to all of you that you are rigorously serving us continuously, and we are really obliged for that. Moving ahead, Neeta ma'am, what do you think about this aspect? What are your thoughts here?
So first of all, let me tell you that for doctors, and while I use the medical language also, I will also bring that communication plays a good placebo effect. When the doctor tells that, hey, don't worry, nothing is wrong with you, you're going to be fine in 5 days, that really boosts up the patients, that boost up the caregivers, because the assurance and the reassurance is coming from someone who is actually owner and who is the authority. So it is just not only communication, it is also how do I speak and in which way do I address. So addressing, acknowledging, and at times even appreciating that I'm so happy that you come on time for your follow-ups. And while I see that you're so, coming on time for your follow-ups, that tells me that you are a great person who is also concerned about your health. So I feel while communicating, if you add this flavor of 3A, of acknowledging the patients, appreciating them, and accepting at times the way they are,
True.
because the patients have a lot of queries. If they stop their queries, the caregivers have their queries. And I totally understand that while with time management, we do not have so much time to sort out all the answers. But if you accept it with smile and with acknowledging, I understand your concerns, but don't worry, main hu na. Become that Shah Rukh Khan, and I will tell you, it just becomes very miraculous. I've seen patient getting actually healed only by the words. So that time it's not the medicine, but it is that doctor who has left that mark, which the patient will always remember. So it is really not only empathetic, it is the love balm which is used. So I think these really adds on to a lot of credential to all the wonderful doctors who are there, and really a big kudos and a salute to the doctors. They've been doing amazing work.
I totally agree. And really good points told by both of you. One thing is reflecting empathy with your gestures and guiding the patient and maybe accepting how they are and trying to treat not only their disease but trying to heal them emotionally is something which doctors are actually looking at. Now, moving on towards the next question, I would consider empathy to be, the core of healthcare. I think empathy and compassion needs to be really reflected in any healthcare professional. So, how do you think that empathy can be very easily reflected in the actions and words of healthcare professionals? Anil sir, I want you to take this up, please.
So, Priyanka, this is definitely a very, very important area because patients who are coming to us are definitely suffering from large number of challenges. Their relatives are stressed, and when they enter into any hospital, they expect utmost care. So, care, when we say care, it's not only with medicine, but it's with words also. Here at this stage, see, I would like to say that empathy is a very big subject, and it's very difficult to talk about this within two sentences, but I would certainly like to talk about one very interesting case study. Now, this case study is of a hospital which is in US, and I'm sure most of the doctors would have heard about Cleveland Clinic. So this Cleveland Clinic is a five-star kind of hospital. So when this hospital was under construction, they decided to spend a lot of money so that they are able to give a five-star facility to their patients and their relatives. Now, when they were hiring doctors or paramedics for the hospital, they decided that we want to hire the best of the doctors from the city or best of the paramedics, even if they are demanding higher pay packages. So they spent money like anything. But then when patients started visiting hospital, they had a patient feedback mechanism, and they realized that patient satisfaction in this hospital was just around 60 to 65%. The authorities were shocked that how come, in spite of making a five-star property and the best of the doctors in terms of qualification or the paramedics having best qualifications, still patient satisfaction is just around 60-65%. They hired an external agency. What this external agency did, they tried to find out the data from other ordinary hospitals in the city. They identified that in these ordinary hospitals also patient satisfaction was in the same range, 60-65%. There was no difference. So then this hospital people, management people, they went deep into analyzing the matter, and they realized that their team was not trained on reflecting empathy. They were very low on reflecting empathy. They started intervention. A lot of interventions were done where right from security guard of the hospital to the medical superintendent of the hospital, the entire management, all paramedics, whether it is lab technician or ward boy, everybody, and even doctors, whether it is junior resident, senior resident, consultant, everybody was included in this training, that how to reflect empathy, what kind of sentences they can choose in reflecting empathy. And these people were made to reflect it at the peak. And with this kind of intervention, you'll be surprised to know that in Cleveland Clinic, after 6 months, the patient satisfaction improved from 65% to 93%.
Oh, that's a huge increase, sir.
Absolutely. And that's the power of words. Imagine that same medicine, same surgery, same lab tests were given, same exercises were being done by the patients. Only words could bring in the magic where satisfaction improved from 65% to 93%.
That's a huge increase. So, with this really important example, we understand that soft skills and especially empathy plays a really important role in terms of say the treatment outcomes, or maybe the patient satisfaction or the overall brand of the doctor or the hospital. Uh, I would now want to understand that, doctors and healthcare professionals are usually focused on technical skills, and that is what is there usually in colleges. And there is no emphasis on soft skills, behavioral skills, and how do you think that these healthcare professionals can get help in terms of upskilling themselves on these very important but neglected skills? Do we have any sources as such, Neeta ma'am?
So first of all, I think this is a very, very important question. Why? Because our education system, it's really sad to tell that the education system only and only focuses on the professional aspects. They do not focus on emotional intelligence. They do not focus on soft skills. Where else, while you even grow in your career, while you step out of your house, the whole thing which comes is your interpersonal skills. It is also all about communication. It is about your behaviors. It is about your soft skills. So apparently, 100% I agree that there would be a lot of scopes. There would be YouTube videos. There could be platforms. There could be some people who are now posting on all the reels and things like that. There could be study material also. But how far is this really going to be helpful? Some might scroll, some might feel bored, some might just scroll and push off to sleep. But if you really upskill and upgrade yourself, then probably the changes can be seen. And for upscaling, upgrading, and upskilling, I think DRFHE is doing an amazing work. At least I have seen the differences in the hospitals, in the nursing homes, even with the technicians. So I've seen a huge change which has come. So definitely, I think the training is going to be wonderful and is the need of the hour.
So, in fact, I would like to mention here, in addition to what Dr. Neeta has mentioned, that whenever we are talking about skill development or learning, of course, there are a lot of digital modes available. However, when it comes to face-to-face training, nothing can beat that. And I'm happy that yes, DRFHE, that is Dr. Reddy's Foundation for Health Education, has that kind of bandwidth available. Where even I'm happy that we are associated. So a lot of training programs are conducted, and those can be leveraged by the doctors who want to train either their staff members or they want to get trained themselves. So that's really a wonderful work being done by DRFHE.
Great. We
And
are.
if I also remember, you also have an LMS, right, Priyanka?
Yes, yes. We also have an LMS because
Yes,
we
yes.
understand that doctors and their staff keep very busy. So we've have an LMS which can help you learn as per your convenience. So we are also being very tech savvy in terms of trainings, and I think that's the need of the hour. And we really appreciate that trainers like you have acknowledged the RFHE and have been continuously working with us to ensure that we are able to provide a quality soft skills trainings for our healthcare professionals. And we've been doing this for a very long time, and eh, close to 20 years now, and we've touched a lot of healthcare professionals, including the lowest rank, right from the security guards to the doctors and CXOs, and providing them competency based training, job based training, and skills that are really required for them to kind of give that extra care to patients, which is the need of the hour. I think we would now move towards the questions. I would request all the doctors to please post in your questions if you have any. However, I have one or two lined up here. Now, one of the doctors here asks that, in the early stages of their careers, it is very difficult for them to break a bad news to the patient. Now, there is probably this, I have also heard from many doctors who say that it is very difficult for us to communicate a bad news to a patient. So, what can be the right way to break the bad news? I think, Neeta ma'am, I would want you to address to this first.
So thank you for this question. And first of all, if it is not only bad news, even breaking the news of being diabetic or being hypertensive itself is also bad, right? So here, I think it is also very important. How do we break the news? While breaking the news, use words that I understand, and I know that it would be difficult, but probably whatever is the best. And this is where we tell that the skills of communication, the use of right words at right time is important. So
Right.
using right kind of words with right thoughts, because someone has lost a person, lost a physical person, lost a person who would be the bread earner of the house. So using words with empathy, using words with care, and using words with respect, because whatever I am telling it to my patient or to the caregivers, it's not only heard by them, but it's heard by rest all the other people also. So they should also remember that, this is a doctor who uses words really very mindfully, very carefully. And while you use this with kindness and respect, it really adds on. And the patient, as well as the relatives, and all the other people who are there. Because whenever you're breaking a news, there are a lot of other people. There is a lot of family members, relatives, neighbors. Everyone are there in the hospital, in the nursing homes.
Right.
So being kind, being polite, and being respectful, using soft voice, the tonality of the voice is also very important.
True.
So,
And sometimes you do not really have to say anything, just touch the person, because non-verbal communication plays a major role. Our
Yes.
ICU patient, they do not speak, but the ICU patient always looks into the eyes and tells the doctor, I want to be fine as early as possible. And in COVID, we have used a lot of non-verbal language.
Yes.
In fact, I would like to add few points here in addition to what Dr. Neeta has mentioned. See, breaking a bad news is just like breaking an egg. Imagine that if a father has to be told that today we will have to ampute your son's limbs, right? Or telling a father that your son's eyeballs have to be removed if you want to see him alive, or telling a husband that your wife will never be able to conceive ever in her life. These are very difficult situations. Now, the way when we break egg in kitchen, so if you do not apply any force, then you will never be able to break an egg. So if you use some very simple, subtle, masked words, you may not be able to do that. But then
Yes.
if you use very harsh language, then you may land up in a mess. So it is a very, very careful process where people can learn how to communicate, where this information has to be given in a masked manner, where we are understanding the other person's situations, we are giving them emotional support while we are giving them this information, right? So that is a very scientific methodology which can be trained.
I totally agree with both of you. Non-verbal communication and using the right way, the right tone really makes a difference. Another question I think is arising from doctors is that uh, doctors usually, complain to us as well when we do a lot of training need analysis with big hospitals that the staff is continuously engaged in their phones.
Mm.
Okay. And they are distracted. So what can be done to kind of not make them being engaged in the phones and focus on what they are here for, that is quality patient care and address to the queries of patients? And how do you motivate them to do that from internally? That should not come from a force. So how can this be done? Anil sir, if you can take this up, please.
So first and foremost, Priyanka, definitely this is a very big challenge which exists. In fact, in last 3-4 years, there are many doctors or managers from hospital. They have called me and they have said that, can you do a session for our staff because they are constantly busy with their phone and not engaged with the patient. See, here the first thing is that we have to make the work as passion and not a pressure, because whenever any paramedic is thinking that this work is a pressure for them, they will not be 100% present in that work. So how to make it a passion for them is something which is again a science, and this can be done because this motivation has to come from within. External motivation certainly will work for some time, but until unless it is an intrinsic motivation, it will not help. And these programs, training programs which we conduct face-to-face sessions, these sessions help a lot in bringing out this kind of behavioral change among the participants.
Right.
So if there are any such challenges, they can definitely, I'm sure if they approach you, they will be able to get a good answer to such kind of concerns.
Right. So, Neeta ma'am, you have trained so many healthcare professionals, and that's your forte. So, can you quote some examples wherein you have actually seen a change after uh, uh, delivering a particular training program? Any personal experiences you have from that front?
So I remember one of the famous organization, rather a hospital management chain of hospitals here, where I have trained. And the best part was when the HR comes and tells that now I see a change in the nursing staff.
Hmm.
So there was a lot happening of
Okay.
conflict between the two states, the Maharashtra and the Kerala, which everyone have experienced, and most of the hospitals have been experiencing this. And the best part was when, after doing the entire training for 3 months, they just come and tell that, first of all, they've been regular on doing the homework. And I'm like, no, I'm not a teacher. But they're like, no, they're doing the homework. And the homework is they actually are talking to each other. They are learning a bit of Malayalam and a bit of Marathi, and there is harmony. Secondly, now we have also started seeing that we have started celebrating festivals together. So this was a very huge and a very drastic change. The
Mhm.
third thing which came out from the nursing staff was, one is, we have now understood why it is important to adapt to people also. We only come with blinders that we are nursing staff, we are nurse, we are professionals, we will only take care of the patient. But we never understood that it is also important to focus on the interpersonal skills, and which our training has really done miracles in that uh, organization, in that hospital rather.
Right. And we are glad that, we are able to make that difference with hospitals. Rather that, when nurses are able to coordinate within themselves, and there is harmony within the hospital, and people are able to communicate in the right way, finally the patient benefits. I guess that is what all of us are aiming at, and we are here to serve the patients, serve the public. So I think that is really important. We are almost ending towards the end of the session. I would want you to give some closing remarks, starting with you, Neeta ma'am. Any closing remarks? Any sign off notes for our doctors?
So basically, I would just tell that as frequently we upgrade our wardrobes, as frequently we upgrade our cell phones, because cell phones are regularly getting upgraded. So it's now the time to upgrade our skills. It's now time to upscale our skills. It's now time to really do things out of box. It's not only talking out of the box or telling people to be out of the box. It's now time to change and be adaptive to that change, be a learner, because ultimately it is service towards humanity and service towards our own self. So let's be that learner, let's be those change drivers who are ready to take the step ahead. Thank you so very much, Priyanka.
Thank you so much, ma'am. Anil sir, any closing notes for our doctors?
Yes. So, one thing which I would like to clarify here, that first and foremost, when it comes to medical treatment, keeping your knowledge up to date is absolutely necessary. And at no stage, I would like to demean the importance of technical knowledge. So, technical knowledge definitely is very important, and we need to update it on a regular basis. But at the same time, we need to give a focus on communication skills and behavioral skills. See, with this communication and behavioral skills, we will be able to reflect care. And in fact, the most important part, one point which I would like to mention here is that, and for doctors to remember, that nobody will care how much you know. I'm repeating, nobody will care how much you know until they know how much you care. So, my dear friends, do reflect utmost care for your patients along with the medical treatment, and you will see a different outcome altogether. So, can we treat them differently?
Thank you so much. Thank you so much, both of you, for sparing this time and joining with us to conduct this very wonderful webinar, which I'm sure will give a lot of insights into all our doctors in terms of prioritizing the need and importance of developing behavioral skills within themselves and also their staff. And to just keep you posted, Dr. Reddy's Foundation for Health Education is always ready to partner with you to understand your training needs and help you reach that benchmark of excellent customer service and patient care. This is Priyanka Hira Lahuti signing off. And with this last note,